Yeah, hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill, and in the following small presentation, we would like to show you one of our cases of the month here made in our clinic. So thank you very much for watching, and we hope you enjoy the video.
Yeah, welcome to our implant library, and today I think is another very beautiful case showing Marion bridges. So great thanks to the dental technician, to the actually master dental technician Barrett Holbel, who's done this work in our lab in Munich. And at the end, when you do work as a dentist, especially to restorative dentistry, what you see at the end is not the dentist work mainly, it is the technician's work. So for every technician on the planet, it's easy to do really white teeth, the American fence, as we call it. That is not difficult dental technician work. What is difficult to blend in your work into a very colorful environment. So this is the case which shows exactly that. So you can see here two missing teeth, very colorful neighboring teeth. Of course, you could just go and veneer them all, but sometimes you have financial limitations. So we just had to get away with two Maryland bridges and a few fillings to adjust the situation. So this is a view from the palatal side, just from on top. And you can see not an easy situation to restore, as we have different sizes of gaps, very colorful teeth, deciduous tooth on the other side. So not an easy situation, but we just went and tried to solve it. So we always try to do as minimal appointments as possible. First appointment, taking the color, and with this aspect we really take a long time, do several color samples, a lot of pictures, to give the technician all the information he needs, because we can always, the technician can only work perfectly if he has all the information he or she needs. So we take pictures with flash, without flash, with a polarized filter, without polarized filter, and so to get it really done, to give all the information the technician needs to them. You can see really a lot of color taking pictures, but it really helps, as you'll see at the end. So then we prepare the tooth after we've given some small local injections, and take actually a digital scan. And then a model is printed and the ceramic is milled out of one block and just colored. No veneering, nothing anymore. So the techniques have really changed. And I think on the model already it looks quite wonderful. So you can see here the bridges in the close-up. The bridge on the left side, I have to say, is an experimental treatment. You have to classify it as such, as the way we did that is for lateral teeth, for posterior teeth. There's not a lot of scientific data available for that. So these have to be done with caution, but we haven't had a single bridge failing now in 15 years. And patients have been all extremely happy with this kind of procedure. So they didn't need to have an implant or a conventional bridge, that means drilling down in the neighboring teeth. So patients have been really happy with these treatments. And yeah, and on the right side is just a conventional Maryland bridge with the most up-to-date materials. And as you can see, absolutely colorful, beautiful. The scientific data for this right type of bridge is completely sufficient, a high success rate over many years. And so we can go and place this bridge, been very happy with it. And this is the printed model, again with the preparation for the situation for the posterior teeth and for the anterior teeth. Full ceramic bridges, just painted, so absolutely perfect. And then the bridge is placed under rubber dam. This part is a little bit tricky and has to be done absolutely perfectly, that the bridges last a long time, and we have to use special cements for that. So that's it. On the day of placement, the pictures have been taken. So we placed the bridges, did a small composite filling for the deciduous tooth, and actually, can you see our bridges? Barely. On the left side of the picture, you can see it a little bit because of the shadow, because the gum situation there is not absolutely perfect. But on the right side, no chance to see anything. So absolutely tremendous work done by the dental technician here. And this is exactly what I want to show, that sometimes if you have a great dental technician, it's really fun to place those restorations, and if they blend into the natural dentition so beautifully. Patient smile, you can see from the smile already that the patient has been very happy with these bridges, and you can't see, if you really look closely, even then it's very difficult for you to see where the bridges are. So excellent work done here by Barrett, and really pleased with that. And closer picture is again on the right side of the picture. The left lateral incisor absolutely perfectly replaced, nothing to be said about that. And on the right side, yes, you can see a small gum deficiency, but the patient was financially very limited, didn't want to have a gum transplant, so I think for that situation, completely acceptable. So thank you very much for your kind attention, and I hope we didn't praise ourselves too much, but to do these treatments is just such great joy for us, and especially if we work with so fantastic dental technicians. So thank you very much for watching, and I hope you forgive me that I liked the work so much. Thank you.